I'm here with Victor Huber, Associate Professor at the University of South Dakota, who's going to talk to us today about monitoring SARS-CoV-2 and how it can be monitored on a community level through wastewater testing. Also here today is Bonny Specker, epidemiologist from South Dakota State University, who's going to give us an update on what's been happening with COVID-19 in our area, in the nation, and in the world. But I'll start with Victor. Now, Victor, tell me a little bit about what you have been working on lately.
So, like many scientists in the last year, we've been focusing a lot of attention on this new virus, SARS-CoV-2, that emerged, just over a year ago. And we're trying to understand a lot about, how it's infecting people, develop things like vaccines. And one of the things we're focusing on is surveillance of the virus in the community. And specifically, we're using wastewater as a way to detect whether or not the virus is circulating within a community, rather than doing, say, individual testing of people to find out who's infected. You can find a lot from wastewater with this virus as far as determining whether it's in the community or not, and how it's spreading in the community.
So Victor, can you show us kind of how that works, or kind of an overall demonstration of what this kind of testing is?
Sure, I'll put in this slide and say, this study was sort of following in line with a number of other places that are doing similar testing in their wastewater. The most notable is the University of Arizona, where they were able to actually use this type of testing in order to identify a potential outbreak of COVID-19. And they did this at a dorm-specific level, so they were able to sort of shut down that dorm so that they didn't have that outbreak. And this is in collaboration with Lisa McFadden and Jamie Scholl at the University of South Dakota. And we've been collecting samples since July 10th, 2020 to the present. And what we're seeing is, if you look at the detection of the RNA for the virus in specifically primary sludge, going from August 2020 through October, you can see an increase in the detection of the RNA in the sludge samples that sort of goes right over the bars of the active cases in the community that we were seeing during that time. And so we've analyzed the data out that far, but it seems to make a nice connection with what's happening in the community. At the current time, we're still processing the more recent samples, and we're hoping to continue with this type of testing moving forward, especially into the post-vaccine era, where we're still going to want to know whether or not the virus is moving through people in the community even after vaccination.
Where do you get those sludge samples from? Where do you take them from, and what areas?
So right now we're just testing the city of Vermilion, just their wastewater and sludge samples from the water treatment plant there. And we don't have anything more specific to like University of Arizona had the individual dorms. We really can't focus down on that specific of a level at this time. We're just doing the entire city.
So moving forward with the pandemic, how could this be used in the future by other communities?
Well, I think, a number of places are already, doing this type of testing. Different cities and states are implementing this. As I mentioned, one of the things that I'd be interested in is someone who's been working with these viruses and looking at, vaccine development, looking at potential mutations in the virus and how that might affect, be affected by the vaccine-induced immunity. I'd be really interested to see how these types of things carry on into the next few months and years of our experience with SARS-CoV-2, as we learn whether or not this virus is going to stay around, or if it's going to eventually go away after a successful vaccination campaign.
So my question is, why do you think, I know your area of expertise is in influenza, so why do you think the numbers of flu are so low this year?
That's an excellent question. There's a lot of, sort of ideas that maybe some of the social distancing measures we're using, some of the, masking and things like that are helping to limit the spread of influenza. But at the same time, we're still seeing pretty widespread, transmission of SARS-CoV-2. And there's a lot of things out there. One thing could be just, that the SARS-CoV-2 is maybe outcompeting the influenza infections right now. This could be something that's going to only happen this season, or it could be something that eventually, affects our what happens with influenza. When we had the pandemic in 2009, there were actually there was a 2008 variant of H1N1 and the 2009 variant of H1N1, and that 2009 variant just replaced the 2008 variant. It is something we've seen with influenza throughout the years, and it may have just been an out competition of the current, the previous isolate, previous type, and that might be what's happening here. But we just have to sort of see. The good thing is that influenza numbers have been quite low, which is definitely a positive.
So with your background in influenza, Victor, I'm just curious, how does COVID-19 and the flu kind of compare when it comes to that secondary infection tending to be the cause of why people get very ill or very sick? How are they similar in that sense, and how are they different?
That's a great question. And, with influenza, one of the things that we do study in my lab are these secondary bacterial infections, and how, primary influenza infection can cause your immune response to be affected in a way that leaves you susceptible to a secondary bacterial infection that often leads to pneumonia and then death. And that's well established with influenza. They're still trying to understand all the immune mechanisms behind it, but we know that there is, a primary viral infection. Oftentimes, individuals will start to feel better, and then you get a secondary bacterial infection that is very devastating and very difficult to treat, even with antibiotics. With SARS-CoV-2, there doesn't seem to be that direct connection with, say, a secondary bacterial infection. A lot of times you've heard stories of, a secondary sort of viral infection or secondary sort of just illness. We don't really know yet if the virus just persists and then sort of reemerges, or exactly how it's happening. And those are the things that we need to learn over the next few months and years as we understand more about the disease that's caused by SARS-CoV-2. But those are some of the ways that it's similar, but then also very different. Is that, and part of that may just be we've had a lot of time to research influenza, and we haven't had a lot of time to research SARS-CoV-2.
Well, thank you, Victor. Is there any other details that you think that the public should know about what you do? And is there any just fun facts that you'd like the public to know about what you've been doing?
One of the things that would be interesting to do from this as well is maybe eventually get the ability to do actual sequencing of these viruses. I think the technology is there to eventually understand if there could be detection of variants that might arise, before we actually see them, in the community, and be able to detect them and sequence them, much like we're seeing these new variants already start to arise with these SARS-CoV-2 viruses. This might be a tool that would allow us to have a bit of a head start on some of that.
Yeah, that really does make sense. Obviously, not everyone's going in and getting tested because they might not have symptoms, but they might have the virus that they're putting into the wastewater system, and you would be able to pull it from there, and that would be very telling. So it'll be interesting to see what happens with this. Thank you so much for talking to us about this today.
Thank you very much for the invitation to chat, and I'll let you know if I have any other updates in the future to bring to your attention.
Well, Bonnie, what do you have for us today for updates? What's been going on with COVID-19?
Well, the numbers have been looking good. This is for data up through yesterday, January 31st. Brookings still is in substantial spread, but as you can see on that graph on the top right, the yellow line is getting down there closer to the orange one. The orange one is the cutoff for defining substantial spread. We've had a total of 3,422 cases, 56 cases this week compared to 67 in the previous week. So down just a little bit, it's kind of inching its way there. We had 134 active cases yesterday. 119 people have been hospitalized. There were 3 new admissions this past week compared to 2 in the previous week. 34 total deaths, 1 this week compared to 1 in the previous week. And test positivity among people tested is 22%, and among tests done, it's 6%. So those continue to be high, but they're definitely going down in the right direction, or moving in the right direction. 5.4% of Brookings County residents have received at least 1 vaccine. That compares to 4.7% last Sunday. As far as South Dakota, it's also in substantial spread. There have been 108,250 cases, 1,102 cases this week compared to 1,604 cases in the previous week. When those cases get down to 864, below that, then the state will be in moderate spread. They'll be out of substantial spread. 2,833 active cases yesterday. There have been over 6,000 hospitalizations, 97 admissions this past week compared to 130 in the previous week. There are currently, as of yesterday, 125 people that were hospitalized and 25 of them in the ICU. There have been 1,778 deaths. That's a little bit, well, it's close to about 1 in 500 South Dakotans who have died from this virus. 73 deaths this week compared to 49 in the previous week. And you can see that on the bottom right-hand graph, the peak, the increase in deaths there. Probably because some of the more recent cases have been in the 60-plus age group, a higher percent of them than earlier during this outbreak. Test positivity among people tested has been 21%, and among tests done, it's 6%. 8% of South Dakotans have received 1 or more vaccines, and that compares to 6.4% last Sunday. And just to sort of summarize some of the data for the counties that have the 10 most populous cities. So here we have Brookings. This is cases over the last 7 days per 100,000 population. So these rates are all per adjusting for population size differences between the different counties. But you can see we were ranked 8th. So we had the 8th lowest. So I've color coded here red. You don't want to be 10th. You want to be 1st in this case. So we have had quite a few cases over the last week. But if you look at it from the beginning of the outbreak, we are actually 1st. We've had the lowest rate per population size. And we've also had the lowest number of total deaths since this outbreak has begun. And then here we have the vaccination data. This is the percent of the population receiving at least 1 vaccine. And you can see here we're ranked last, where 1st is the highest percent. So rank of 1 means the best. So in the case of cases and deaths, that would be the lowest number. In the case of vaccines, it would be the highest number. So one thing to clarify here as far as this rank of 10, this doesn't have to do with the acceptance of the vaccine in the community or the ability of the county to get that vaccine out there. The vaccines are being allocated differently to counties. So I'm not quite sure how that allocation is occurring, but I'll let people know when I find that information out. I have asked some people for that information, but Brookings is putting out or vaccinating people as soon as they get the vaccine, and people are accepting it. So it's not a reflection of what's happening at the county level. As far as the United States, this graph with the cases per day, we are seeing a good drop there. There were 1.08 million new cases this week compared to 1.26 million in the previous week. And there have been 450,000 deaths, 22,000 this week, 22,000 last week, difference of just a few hundred. People are concerned here, though, that we're going to come back up with some of these variants that they have been detected. But hopefully we can get enough people vaccinated in time before that takes hold. As far as the world, there have been over 100 million cases, 3.81 million this past week compared to 4.37 million in the previous week. But again, as you saw it with the US and worldwide, we're also seeing this decline. 2.23 million deaths from this virus so far, 99,000 deaths this week, and close to 99,000 in the previous week. So it looks like both in the US and worldwide, cases are starting to drop and deaths have stayed kind of steady. And we should see those dropping soon as well, because there is that delay between the time a case is diagnosed and when someone is passes away from this. So I saw this somewhere and I just really like it. I think we need to all remember that we need to practice patience. Vaccines are coming. We need to have discipline and double down on public health recommendations to keep this outbreak under control. And we need to have solidarity and realize that we are all in this together. And I think we can get through this if we just keep reminding ourselves of those three things. So that's all for this week.
Thank you for watching today. And for those of you that have questions for Bonny or about COVID-19, please email us at the email address included in the description of this video. Until next week, continue to practice patience, discipline, and solidarity. Thank you, Bonny.
Thank you.